Sometimes we want to be on the in crowd and be in the majority, but there are times where we don't want to be in the majority. As a matter of fact, it can be dangerous to be in the majority and be like everyone else. What am I talking about? I'm talking about the conditions of obesity and pre-obesity or overweight, where over 2/3 of all American adults have obesity or overweight. So if you look to the person to your left and you look to the person to your right and you look at the person in the mirror in front of you, at least two of those three faces are dealing with obesity or overweight. And why is this important? Because there are so many health complications as a result of obesity and overweight that if we can help someone have a healthier weight, they can look better, feel better, decrease the complications, have a healthier lifestyle, and maybe even save some money. So what do I mean by that? Well, with obesity and overweight, there's all of these other complications such as heart disease, high blood pressure, type 2 diabetes, high cholesterol, high triglycerides, heart attack, premature death, gallbladder disease, ovarian cancer, prostate cancer, osteoarthritis. We look at all of these conditions that so many people in America suffer from, but the neat thing about it is losing just 5 to 10% of your weight greatly reduces the risk of some of these complications. And so as a medical doctor, that is one of my passions, is helping people lose 10% of their weight so that we can enhance their health and wellness to improve your quality of life, to help them look and feel their best on the inside and out. So my name is Dr. Angelise Alexander Martin. I am a medical doctor and I'm a board certified obesity physician, and I have been specializing in helping people lose weight since 2009. And again, the reason why it's so important is because of all these complications. But obesity is a chronic condition, but it's also treatable. And I have treated so many patients and helped them lose weight. They're feeling better. They're off their pain medicine because the joints don't hurt as much. I've gotten patients off their blood pressure medicine, their diabetes medicine, because they've been able to successfully lose weight and keep it off. An ounce of prevention is worth a pound of cure. So if you do something today that can prevent some of these complications down the road, think about what you've saved between time, improving your health, improving your interaction with your family members because you can more likely run, jump, be more active because you have a healthier weight. So my goal again is to help patients with obesity or overweight lose at least 10% of their weight. Now, how do we define obesity? Obesity is defined by something known as the BMI, or body mass index. And the body mass index is the international standard for weight, where you take your weight in kilograms and divide it by your height in meters squared. And if you have a BMI greater than or equal to 30, that meets the definition of obesity. And for a lot of patients, that's simply 30 pounds above their ideal body weight. It doesn't take much to get there. If you have a BMI greater than or equal to 40, that puts you in a category known as class 3 obesity. And if your BMI is greater than 25, that puts you in the category of pre-obesity or overweight. So if you had a 5'10" gentleman, for instance, who weighed 200 pounds, his BMI is almost 29, which means he's flirting with obesity. And if you have a lady who's 5'5", weighing 170 pounds, her BMI is also almost 29. So it's not uncommon to see people with these heights and these weights. And again, that's unhealthy. There's a lot of medical complications that they could suffer from. But if we're able to help them get a healthier weight, again, losing just 5 to 10% of their weight greatly reduces the likelihood of some of those complications. So if you or someone you know is dealing with obesity or pre-obesity, I would love to partner with you to help you get a healthier weight, to help you feel better, increase your longevity, etc. Improving your quality of life is what I'm passionate about. So I would love to partner with you. And if interested, feel free to give us a call here at Pro Health Services. Our telephone number is 614-442-2600, or you can visit us online at www.prohealthservices.org. Again, this is Dr. A with Pro Health Services, and we'll see. Bye for now.